A Supreme Court ruling earlier this year gives local governments the authority to ban people from sleeping and camping in public places. Critics say the ruling does nothing to solve the homelessness crisis. In tonight's Eye on America, CBS's Adam Yamaguchi takes us to Los Angeles, where the mayor has launched a program that could provide a long-term solution.
This is Coley King's mobile exam room.
We want to be there for them.
4 days a week in Los Angeles, the street doctor with the Venice Family Clinic makes house calls to those without homes.
We saw you, and really the last time was 2021. And then after that, we kind of lost track. We lost contact, so here you are.
53-year-old Melissa is one of more than 45,000 people experiencing homelessness in the city of Los Angeles.
There are patients that suffer from very serious medical illnesses. There are patients that have schizophrenia, have HIV. So I think there's urgency from everyone to solve this.
Nearly half of all Americans living on the streets are here in California, where there was roughly one shelter bed for every 3 people who needed one last year.
It's time to move with urgency at the local level to clean up these sites.
Earlier this year, leaders like California Governor Gavin Newsom were empowered to take action in clearing encampments after the U.S. Supreme Court ruled that cities could ban people from sleeping outside.
There are no longer any excuses.
Easy to say, perhaps, but the reality is more complicated.
The goal has got to be to solve the problem.
Karen Bass is the mayor of Los Angeles.
Our problem here is we don't have enough housing. We need to build. We need to purchase buildings.
And that's where she's focused, getting people off the streets and into shelter that up until now did not exist. She's doing it by leveraging empty motels and city-owned properties with the goal of moving people indoors urgently and clearing encampments permanently.
You don't solve anything by clearing an encampment and just moving them to the next street.
So far, since 2022, her Inside Safe program has brought more than 3,000 people indoors from over 60 encampments. And the city has seen a drop in street homelessness.
This area right here, many months ago, was filled with tents. And you can imagine what family wants to bring their kids here right there if this is filled with tents and you're afraid of the people that are here. And look at it now.
Jessica has been unsheltered since 2019. Just days after we met her, she was placed in interim housing.
I should be able to get some more rest, but this has been very stressful.
Others, like Brian, are still waiting.
It's hard to be on camera showing this.
We're dealing with massive numbers, so it is going to take a while. I wish I could tell you that on this date, this problem would be ended. I can't do that. But what I do know is that if we continue along with the trajectory that we're headed on, we will be able to solve this problem.
It's an approach that could also solve a problem for Dr. King.
You may lose contact with people unless there's a plan in place.
Absolutely. We may lose them, and we may lose them forever because they are that sick. I have faith that here we're already on that pathway to try to do this the right way.
A crisis decades in the making, changing one day, one life at a time. For Eye on America, I'm Adam Yamaguchi in Los Angeles.
New tonight, the federal government reports that there has been a double-digit jump in American homelessness compared to last year, and an even bigger jump among families. CBS's Lilia Luciano is digging into what's behind the spike.
The shocking increase in the number of people living without housing in American cities is no surprise to Cynthia English, who spent 10 years experiencing homelessness.
Low-income housing is not truly affordable for those of us who make the leaps.
According to the government's latest data, more than 770,000 people were unhoused in a single night in 2024, up 18% from the year before and the highest number ever recorded.
It can happen to anybody.
Steve Berg is the chief policy officer for the National Alliance to End Homelessness.
Would you say that the stigma around homelessness takes away from the priority to solve the issue?
I believe it does. What we really need is we need the communities to be committed to actually solving the problem and not just blaming people who are homeless.
The United States Department of Housing and Urban Development blames the record-breaking increase on the rising cost of living.
It costs more to rent a modest apartment than people make in a modest job.
Devastating natural disasters like the Maui wildfire that displaced thousands have added to the shortage of housing. The report also says the number of homeless families more than doubled in some cities like New York and Chicago, where migrant families were bused from border states.
It's going to keep getting worse until we all come together. That means city, state, federal, landlords, brokers, all of it.
Cynthia says that it's important to meet people where they are, and part of that means providing a place to live first and then addressing other needs. That for many people, getting a house is just the beginning of the journey, not the end. Tarika?
Absolutely. Thank you, Lilia.
More than 700,000 Americans experienced homelessness last year. In addition to being unhoused, many lack adequate medical care. In tonight's In Depth, CBS's Elise Preston found one initiative in Los Angeles where the doctors aren't in the house, they're in a van, searching for their next patient.
Who are we seeing next?
We're going to be seeing Isabella. She's been hit by a car a couple years ago.
Oh my goodness.
Catherine Parsikian and her team at Healthcare in Action provide medical care.
Here she is.
To those living on the streets in Los Angeles.
You got it? Yeah. How's your knee doing?
The team treats Isabella Birdfeather for chronic pain, substance abuse, and mental health. She escaped domestic violence last year and has been unhoused since.
I was at an encampment and I came up to one of the workers and I said, "Can you please help me?" And they said, "Sure, we can help you."
You're getting emotional.
Yeah.
Why?
Because they're so amazing. They helped me in my darkest hour.
It's help that routinely comes to wherever the patients are, in encampments, on sidewalks. Many patients are seen weekly.
You think about something as simple as using insulin. People on the streets don't actually have refrigerators where they can actually store their insulin, so you actually need to find creative solutions to be able to help them.
Dr. Sachin Jain launched the program more than 3 years ago to combat the growing gap of people without stable housing and medical care. Today, the nation battles an all-time high. Nearly 750,000 people are experiencing homelessness.
Why do you say at core it's a healthcare issue?
Well, I think many people find themselves homeless because they've had a health event. It could be a behavioral health issue. It could be a chronic disease that goes untreated.
But the ultimate goal is to get people off the streets.
I was just trapped in a nasty addiction. I continued to try to end my cycle of homelessness, but it kept failing.
Case manager Eric Barrera knows the hurdles firsthand.
There's no way our patients can burn bridges with us. Sometimes they might not want us to come back, but we'll just let them know that, hey, we're here in case you change your mind.
HIA provides continuous care for at least 3,500 people.
Usually when people interact with unhoused people, there is no interaction.
People don't look at you. People don't talk to you. You don't get a hug often. This is patient-centered care. We want to make sure that you are getting what you need and we are doing what's going to make you the most comfortable.
We're just one patient interaction away, in some cases, from actually solving these people's problems.
It's a good step forward for you.
Yay.
Absolutely.
I'm excited.
On this day, they found Isabella a shelter.
Thank you.
Housing and health care providing hope.
Bye.
Elise Preston, CBS News, Los Angeles.
Homelessness in America is at a record high, with more than 770,000 unhoused Americans in 2024. While the government doesn't track the number of unhoused who are working, shelter service agencies say that number is growing too. It's a symptom of what's being called the affordability crisis. For tonight's interview, we turn to author Brian Goldstone, who has a new book, and it's called There Is No Place for Us: Working and Homeless in America. Brian, thanks so much for joining us. Can we start with, you write that the term working homeless seems like an oxymoron. Tell us who would fit in that category and why it's an oxymoron.
Yeah, so in America today, across the country, a low-wage job is homelessness waiting to happen. The number of people who fit that description, working homeless, that is not like a tiny number. That's not a marginal phenomenon. A growing portion of the low-wage workforce is either at immediate risk of falling into homelessness or is already experiencing homelessness. And you mentioned that official number of people experiencing homelessness in America, around 770,000, which is the highest number on record. But But by cobbling together different data sources, what I've been able to find is that the actual number is roughly 6 times that amount. And a huge portion of that number of people experiencing homelessness are people with jobs.
You have a startling statistic in the book. It says, today there isn't a single state, metropolitan area, or county in the United States where a full-time worker earning the local minimum wage can afford a 2-bedroom apartment. Give me a sense of some of the jobs that we're talking about here that people have who are working homeless.
Yeah, we're talking about people who are working at McDonald's, who are working at Walmart, who are packing boxes for Amazon, who are doing airport runs for Uber and Lyft. And when they finish their shifts, they're returning not to an apartment, but in many cases, they're sleeping in the very car that they just did that airport run in. Or it's a family that when the mom gets off work at Walmart, they're going to a shelter, or they're doubling up with others, or increasingly, they're going to these squalid extended stay hotel rooms.
You focused on Atlanta. Why there? And is Atlanta idiosyncratic or representative of larger trends?
In one way, Atlanta is special. Atlanta was the first city in America during the 1930s to build public housing. And during the 90s and 2000s, Atlanta was actually the first city in America to demolish all of its public housing. So in a way, you could sort of tell the story of housing policy in this country just through Atlanta's own trajectory. But the reason the book is based in Atlanta is more because of how representative it is. You know, over the last decade or so, Atlanta has undergone this dramatic renaissance, this much celebrated transformation of its urban core. And that is a trend that we're seeing across the country. We're seeing, unemployment at a record low. We're seeing the economy in these cities booming, and we're also seeing the very people who power those economies, the very people doing the jobs that make our cities run. They are increasingly not just getting pushed out of their neighborhoods, but they're being pushed out of stable housing altogether.
So 20 seconds left, Brian. Is that why you say families are not falling into homelessness, they're being pushed?
Absolutely. Homelessness in this country is a policy choice. That's a choice that we as a society have made. And it also means that we have a choice to stop this devastating trend.
Brian Goldstone, the book is There Is No Place for Us, Working and Homeless in America. Thank you so much. The number of homeless in America is growing. The Department of Housing and Urban Development reports that more than 100,000 more Americans were unhoused in 2024 compared to the previous year. In tonight's In Depth, CBS's Ian Lee looks at the effort to end the chronic problem in Kansas City.
Many consider this the most dangerous area in Kansas City. But for years, couples Smoke and Serena have called it home.
Violence, oh man, violence is, it brings out the worst in you, man, down here. It pushes you to a whole nother limit.
Here, you sleep with one eye open.
You never know if you're going to wake up the next day, or you can't take a nap. You never know if somebody's going to come in and try to steal your stuff or rob you.
Josh Henges leads the city's fight to end homelessness. A tall order, as Kansas City has the worst rate of chronically homeless people sleeping on the streets in the country.
We're trying to build something here. Yeah. The goal is to get people out of this.
At his side are Kevin Morgan and Nick Allen. Allen is the point man. He works to build trust, a crucial step in getting people off the streets.
You left? You're over here?
On this day, they're checking in.
We are set to double our homeless population in less than 4 years because we're not doing this right.
Henges wants to change that.
Homelessness is the most solvable problem America has chosen not to solve.
What steps would you take?
Number one, you got to align funding. You got to build a system that delivers people out of homelessness, no matter where they fall in. That is what you have to do.
I'll strip this down.
He calls it functional zero, aiming for anyone who becomes homeless to be back on their feet in 30 days.
There's enough money currently in this system to solve this problem, but it is not coordinated.
To do that, he wants to direct churches, aid organizations, and shelters to align their resources to get people a place to stay while supporting their needs, similar to the services at Shelter KC.
If you just put in affordable housing and you don't deal with the core issues of addiction and mental health, then that's not going to end homelessness.
Executive Director Eric Berger wants to make sure people first feel safe and seen before helping them become successful.
Many of our people have never had healthy relationships, so you're connected into a good workplace, good housing, a support system of a church, a recovery group.
So it's a holistic approach.
It's a holistic approach, but it's also how do we have relationship with people?
For Smoke and Serena, they're getting a new home, and not a moment too soon. Their previous tent burned down.
It's just going to be nice opening and closing the door. Hey, we're home. Yeah. Let's just keep doing it, you know? Hey, we're home.
A home and a new, safer place to call their own. Ian Lee, CBS News, Kansas City.